You just lost a tooth, so what should you do now? Should you get a dental implant immediately? Should you wait for a while? Or should you simply leave the gap as it is? In this video, I help you understand each option and more importantly, when each approach may actually be right for you. First, there's something very important you need to understand. A tooth is not simply a tooth. Every tooth has a specific position and a specific role within your entire chewing system. Your molars help you chew and grin food. Your front teeth help you bite, speak, and of course, they play a major role in your smile. Your teeth also help maintain a stable bite, support the height of the lower part of the face, and allow your chewing muscles to function properly. So when one tooth disappears, you don't simply lose that one tooth. You create a gap in a system that is designed to work together very precisely. And the problem is your body will not necessarily leave that gap unchanged. Imagine that you just had a molar extracted. At first, you may feel that everything is completely normal. You can still eat, you can still speak, and you may think, oh, it's okay, I get the tooth replaced when I have time. But that period of waiting can cause changes that you may not notice immediately. Usually, after several months, the teeth next to the gap can start moving into that empty space. The opposing tooth can also move up or down as it looks for a new point of contact. In other words, the surrounding teeth begin trying to fill the space left by the missing tooth. And as this happens, the position of your teeth can change. The angulation of the teeth can change. The space can become narrower and your bite can change as well. This is exactly why delaying treatment for too long can make what could have been a simple implant case much more complicated. For example, imagine you lost your first molar. Originally, you have the tooth in front of it and the tooth behind it, but over time, those teeth can begin to tilt toward the empty space. Eventually, the space may no longer be wide enough to place an implant of the appropriate size. At that point, we may first need to recreate the space, and sometimes that means orthodontic treatment. So instead of simply placing one implant, you may need an additional stage of treatment. That means more time, more cost, and a more complicated treatment plan. But that's not the only problem. When you lose a tooth, the bone in that area can also begin to resorb. This is a natural process. When there's no longer a tooth root transmitting functional stimulation to the bone, the body gradually remodels that area, and the volume of bone can decrease. So the longer you wait after losing a tooth, the more bone you may potentially lose. And when there isn't enough bone, placing an implant may require additional bone grafting. That's why I often tell my patients, don't just think about the tooth you lost today. Think about how that empty space may change over the next few months or even the next few years. So what options do you actually have? Basically, there are three possibilities. The first option is immediately implant placement, meaning the implant is placed immediately after the tooth is extracted. The second option is delayed implant placement, where we wait for a period of time to allow the tissues and bone to heal before placing the implant. And the third option is not replacing the missing tooth at all. But the third option is not necessarily the best choice. Depending on the location of the missing tooth, your bite, and the condition of the rest of your teeth, leaving the space untreated can lead to the changes we just discussed. So even choosing not to replace a tooth should be a decision based on proper evaluation. Now let's talk about the first option, immediate dental implant placement. It sounds very simple. Remove the tooth, clean the socket, place the implant immediately, and in some cases, we may even be able to place a temporary restoration soon afterward. But not every case is suitable for immediate implant placement. To place an implant immediately, we need to carefully evaluate the condition of the tooth and the surrounding bone. For example, if the tooth was lost because of trauma, a fracture, or a cracked root, and the surrounding bone is still in good condition, this can potentially be a favorable situation. But if the area has severe infection, an abscess, a laxis, pus, or significant bone damage, immediate implant placement may not be the appropriate choice. This is something many patients misunderstand. Immediate implant placement does not mean it is always better. Immediate implant placement is beneficial when the biological and mechanical conditions allow us to do it safely. Another very important factor is the initial stability of the implant. An implant is an artificial structure that is placed into the bone. After placement, the implant needs to have a sufficient stability so that it can integrate with the surrounding bone. If the implants do not achieve adequate initial stability, the risk of failure can increase. Especially when an implant is placed immediately and loaded too early before it has become sufficiently stable, the risk of implant failure may be higher. That's why in cases involving immediate implant placement and immediate restoration, treatment planning and load control have to be extremely precise. And this is also why I want to emphasize the role of the dentist. An implant procedure is not simply, let's remove this tooth and put an implant in. The dentist needs to evaluate your x-rays or CBCT scan. We need to assess the bone, we need to assess the soft tissue, we need to evaluate your bite, and we need to plan the final restoration. And most importantly, the surgical and restorative teams need to work together because the ultimate goal is not simply to place an implant. The goal is to create a tooth with the correct position, shape, function, and appearance while maintaining long-term stability. So what happens if immediate implant placement isn't possible? That's when we may choose delayed implant placement. In some cases, we may wait several weeks after the extraction. If the extraction site heals well and there is no remaining infection and the bone has been preserved adequately, we may be able to place the implant at that stage. In other cases, especially when there have been a significant infection, a large cyst, or substantial bone loss, we may need to wait longer. Bone grafting may be necessary first. Then we allow the bone to heal and become stable, and only after that do we place the implant. This process can take several months. It may sound like a long time, but sometimes waiting is actually the safer choice. Whenever I consider immediate implant placement, I am even more careful about evaluating all the risk factors. I don't simply ask, can we place an implant? I have to ask, if we place this implant today, how likely it is to remain stable and successful for many years? That is the more important question. Another thing patient needs to understand is that placing the implant does not mean the treatment is finished. In many cases, we will use a temporary restoration first. Once the implant has successfully integrated with the bone and the soft tissue has stabilized, we can move on to the permanent restoration. This is especially important in the front teeth. Removing and replacing a temporary restoration needs to be done very carefully. If it is handled incorrectly, we can put unwanted stress on the implant. So even something that may seem as simple as removing a restoration screw needs to be performed correctly. So if you just lost a tooth, what should you do? Don't automatically decide, I'm going to get an implant immediately. But don't assure, it's okay, I'll deal with it in a few years from now. The best thing to do is get the area evaluated as soon as possible. Your dentist needs to assess the missing tooth, the bone, the soft tissue, any infection in your bite. Only then can we decide whether you should have immediate implant placement after several weeks, or treatment after several months, possibly with bone grafting if necessary. There is no single timing that is right for every patient. The best time to place an implant is the time that is most appropriate with your individual biological conditions and treatment plan. If you just lost a tooth, don't wait until the gap starts causing problems before getting it checked. Because when we identify the situation early, we usually have more options. And when we have more options, treatment can often be simpler and more predictable. If you'd like to find out whether you may be a candidate for immediate implant placement, you can schedule a consultation with a dentist. We can evaluate the condition of your teeth and bone before recommending a treatment plan. And if you ever had an immediate dental implant, share your experience in the comments. Did you have your implant placed immediately after extraction, or did you have to wait? And how was the final result? I really love to hear your story. I'll see you in the next video.